Hello, everybody. Welcome. We're so excited you're here. Let's just see. It looks like, wait for some people to hop on. They're probably just getting the notification. All right. Say hi when you join. We just want to make sure we see your questions. There is a Q&A. Let me enable that actually, so we can, there we go. So we can see those questions come in there as well. All right, looks like people are joining. Perfect. You never
Happy
know.
Friday, everybody. Thanks for joining.
Yes, happy Friday. All right, as you guys know, I'm Dara and I am here with Allie. So excited to be doing this again. So we are going to be talking about very highly requested managing side effects. So I did write down everybody's questions that were coming in through the app. But please feel free to also send them either in chat or the Q&A. There is a section that says ask a question. Pamela is our moderator. She'll be tracking those. If we miss something, just send us a message. We have a new profile on the app that is specific for 5410 support. So we are also monitoring that in case you don't want to post things in the patient support space. We understand that there may be things that you don't want public on there. So please feel free to message us there as well, or of course help at 5410.com. So yes, Allie, do you want to say anything before we get started?
Yeah, well, thank you guys for joining. I'm really excited that we get to do these again. The main thing I do want to say just before we start is obviously we can't cover every single side effect that we see. We'll talk mostly about the most common things we see, what's kind of normal, what's abnormal and more serious. But just know that, if you're ever curious if something could be a side effect, please reach out to us in the portal. We want to be able to help you through those things. And so if you don't hear something said today, it doesn't mean that it's not something that you need to get some assistance with. Also, just know that, we're just going to briefly kind of talk about the main points that need to be covered. So if you ever need any more additional support, please let us know in the portal as well.
Yeah, that's good. I see sometimes things come up in Facebook or the app that are like, oh, I've never heard of that one. So yeah, the portal
Yeah.
is the best place. So all right. So what would you say, Allie, the most common side effects when being on any GLP-1? And is there
Most common
a
would be
difference in the
nausea.
two? Yeah.
What's that?
Is there a difference in the two, where you may see more or less with sema or tirzepatide?
You could have really, any of these side effects with either one. At the end of the day, they are both GLP-1 medications. We will have some people request tirzepatide, sometimes saying that, they've heard there's less side effects. There's not really any evidence to support that, but, sometimes people will do better with one over the other. So if you have a lot of side effects on one, you can always consider trying the other to see if it works better for you. The main thing to know, like if you're having side effects, number one, you should never increase your dose. At the end of the day, the dosing that we give you on the prescription is more of a supply than a dosing schedule you have to follow. Every patient's different. So just know that. Most common though, nausea, constipation, acid reflux, fatigue, diarrhea, sometimes headaches, but those are the most common things that you're going to see. We'll kind of go through each thing here in a second, but as far as management goes, but with other side effects you might see, site reactions, they are pretty common. More so with tirzepatide, I would say, than semaglutide. Main thing to know about that is it is normal and treatable and we can help you with that. But if it's ever like getting hot, swollen, warm, not just localized at the injection site, that's something that you should take seriously and let us know. But typically, if it is just localized at that site, you might just be able to treat it and it'll go away eventually. And things that are not normal that I always tell people always, take it seriously, even if it's not something serious, but please tell us about, would be like abdominal pain, vomiting, fever. Um, a lot of people think like, oh, I don't have any side effects, it's not working.
Yeah.
No, it's actually the opposite. You basically, those lower doses that we put you on it in the beginning are to help prevent those side effects from happening. But if you're seeing a lot of side effects, especially if they're getting worse, you don't want to ignore it. Your
Mhm.
body's obviously trying to tell you something. So whether it be a dose is too high or there's something more going on, please let us know so we can help you work through that.
Good deal. On that, I know that with the instructions, we do recommend cleaning off the top of your vial and the site. Would that help as
With
well?
the
Or
injection site reactions, I have seen it for some reason be more common as people go up in the volume that they're taking, and it's kind of like a temporary thing that you will usually go away. But obviously, some people just are more sensitive. Um, but you always want to clean the top of your vial, no matter what, whether you're having a site reaction or not.
okay.
Cleaning your abdomen or wherever you're injecting first and letting that dry is always important too, um, just to help prevent infection.
Okay, awesome. That is good. And then, so to go back kind of on the more specific things that you address. So let's go back to nausea and vomiting. Um,
Mhm.
that are associated with the GLP-1s. One of the
Yeah.
questions I see sometimes, because we do include BPI, does include Zofran. So sometimes people are like, is it because there's so many side effects? And no, obviously it's just it's good to have if you need it.
Yeah,
If you don't, that's great.
exactly.
But yeah.
Yeah. I mean, that we started including it because we could with those orders because of the fact that nausea is the most common. But when you're nauseous, you don't want to have to wait
Mm-mm.
until we open and then the pharmacy to process it. It's like when you're nauseous and you don't feel good, you kind of want it at that point. So that's why we started to do that. It is designed to only be taken as needed. So I like to tell people with the nausea, first 48 to 72 hours after the shot, especially when you're first starting the medication or going up on a dose, is the most common.
Mhm.
When it becomes to a point where you're having it all week, all day long, you're having to take Zofran around the clock, that means your dose is too high.
Mhm.
So if it is something just kind of for a few days, you can just stay on that dose until that's gone, and then you can, if needed, go up if it's necessary. But if it's going on all the time or you're vomiting,
Mhm.
please hold that next injection and talk to us about what to do at that point. We want to make sure that we're addressing it and going down on your dose.
Okay.
Vomiting, like I said, I always take it seriously. It is always a warning sign to me. So that is something I will get on the phone with you about if it's something that I think is necessary or just going down in your dose first. But the main thing to always consider is, is abdominal pain happening? Are you throwing up after you eat?
Mhm.
Those are the questions that I will typically ask because that will give me more information. If you're ever vomiting and you have abdominal pain, go to the doctor, go be seen because that's what I'm going to tell you anyways, and then we can get on a call after that and discuss next steps. But we want to make sure that we're not missing anything big, and so please
Yeah.
don't ever ignore that.
Okay. Great. Um,
The other
and
thing too with vom or for nausea that I'll touch on, and we do tell you this in the portal, but um, going too long without eating
Mhm.
and overeating can trigger it. So try to stick with small, frequent meals. That usually will help. Put something on your stomach, even if you're not hungry. And that will usually help prevent it. Fried, fatty, greasy foods. That's kind of the common thing with a lot of these GI side effects, but those are the foods you want to avoid.
Okay. Yeah, I would say I am a repeat record, broken record is that Rachel, our RN, has always said, you have to eat. The goal is not to not eat. And sometimes people, they, especially someone like me who's had disordered eating and things in the past, is, it's just a good reminder of that.
Hmm.
You're nauseous. You do have to eat. That's not the goal. So,
Yeah, for
um,
sure.
and then yeah, you talked about the foods that do trigger. So yeah, and don't increase the dose. And again, broken record, reach out to the portal if there's anything that you're concerned with. Um,
Yeah, and if your order doesn't come as Zofran, because we don't have it like with Hallandale orders, things like
yes.
please feel free to reach out to us on the portal. We're happy to call it in to your nearest pharmacy too. Yeah.
Perfect. Okay. And then, so just with those, is there, you talked about the foods that you should avoid. Is there any other dietary changes that we should be making while we're on a GLP-1 to
Yeah,
reduce things like that?
that is kind of a whole nother topic that we can go into. I do want to do um, a meeting on that coming soon because I think it's really important to understand the foundations. I would say like foundation is key. Like there's not one set diet that is like you have to be on. Like at the end of the day, these medications are going to help you be successful. However, learning to eat the right things is really important in setting those foundations so that you can be successful for the future. So,
Mhm,
I always think that, you know, understanding the basics of eating healthy, if I go tell you to eat healthy, knowing what that means is really hard, right? So that's why I'm saying like it's kind of another thing I want to dive into.
mhm,
But, avoiding those fried, fatty, greasy foods are going to help because we're slowing down that gut and it's
mhm.
harder for the body to break down those foods and process. So, if you have a lot of upset stomach, that's kind of the first step.
Yeah.
But just trying to get good protein, like you want to eat a lot of protein. It's hard and it's way easier said than done, but like
Mhm,
shooting for 90 grams to 100 grams a day is ideal. It's going to help with a lot of different things, but it's key when you're on these medications to make sure you're intaking enough protein. You
yeah.
don't want to be so calorie deficit that like you're just starving yourself and you go into nutritional issues.
Mhm,
That's when you're going to see the hair loss and the other side effects that happen. You want to make sure you're building the foundation to eating good fruits and veggies,
yeah.
good carbs, what that means to eat these good foods, nutritious foods, so that your body's getting the right nutrients.
Mhm,
And then, getting good craving control, portion control is the key. You
yeah.
don't want to be, if you're forcing yourself to eat, I always tell people that means the dose is too strong. Um, that's not the point of the medication.
Not the goal.
Yep.
Okay. Awesome. And then, um, I think you kind of touched on, food tolerance and things like that. Are you able to tolerate your food and things like that? So, okay, sulfur burps. This is one that comes up quite frequently. And I myself posted, I have not had this side effect that some people have, but my husband does. And I posted in the app, I was like, what are you guys doing about this? Save my marriage because this is brutal. So,
Yeah, yeah, no, I do hear that from time to time.
yeah.
Overall, like, when you're talking about bloating, sulfur burps, it kind of goes hand in hand in the sense that like at the end of the day, we're decreasing that motility in the gut. And so you're going to have increased intestinal gas, but also like the sulfur burps in general are basically like a byproduct of the metabolism that we're having happen. So it's creating this hydrogen sulfide. And there's certain foods that can make it worse, like eggs, meat, broccoli, cabbage, things like that.
Okay.
But overall, there's a few things you can do to help like prevent it or to make it better. Number one, avoiding certain foods that you feel like that pay attention to certain triggers for any of these side effects, especially those things, and avoid it.
Mhm.
But you want to avoid carbonated beverages. That's going to create more of that bloating and gas feeling. And then small frequent meals, like I talked about. Sometimes if you eat too fast, it can introduce too much air into the stomach and make it worse. But the frequency is better. Like if you're doing small amounts instead of having to have the stomach digest a large thing, and your stomach's like, whoa, I don't know what to do with this. So keep it
Okay.
small and light. And then if you are having reflux or you think it might be a contributor, you can take a daily, like over the counter anti-reflux medication if you're not already on one.
Okay.
Always talk to your doctor if you think it might be something that interacts with another condition or other medication you're taking. But taking like a daily Pepcid or Nexium can also help. um, Probiotics is
Okay.
another good option just for gut health in general. Sometimes like bad bacteria, not having enough of that good flora can cause more of that hydrogen sulfide production. So probiotics can help too. And then if you're still having trouble, let us know. I will say this is not, and I will just say this first, this is not like a proven thing, But I will say just from experience, like what I hear and talking to patients, I see the reflux and the sulfur burps more with semaglutide than I do with tirzepatide.
Okay. Yeah.
There might not be anything to that,
Hmm.
but it's just something that I've noticed. So,
Interesting. Yeah.
yeah.
Yeah. And then just the treatment you talked about, lifestyle, foods, fiber, laxatives. Um,
If you're, well, the main thing to think about that, like if you're having
oh,
constipation.
sorry.
So,
Yes,
like
that's what
the
I
first thing I tell people
skipped.
is if they're having a lot of that upper bloating, my first question is, are things moving the right way on the
Hmm.
other end? Because, the first thing you're going to have happen if you're getting kind of backed up down there is that you're going to start noticing things back up and having a hard time processing from the upper stomach. So,
Okay.
if you're having constipation and you're having that abdominal bloating, uncomfortable feeling, burps, then try to get the constipation resolved and it should help have things move the right way.
Yes.
And so that's just one of the questions I ask. We'll go into constipation here in just a second and how to
Yes, I
manage and prevent
accidentally
that.
skipped ahead on that. Yeah,
It's
yes, because
okay. Yeah.
that's huge. That
Yeah.
is like
So that's kind of the
obvious,
main
but
thing I like to ask. And
yeah.
because like that's something that might get missed and it will
Mhm.
cause the whole GI system will get messed up whenever we're not going to the
Mhm.
bathroom. So
Yeah, that is definitely one that gets asked a lot, and just the different things. I love that in the app that people are able to share stuff like that, just so because it is very normal and a very common side effect, it seems like, with constipation and um
I do see a question from Amanda Ray, and I'll just touch on it really
yeah.
quickly before we move on about
Mhm.
surgery.
Yeah.
So, National Anesthesia Guideline is to hold GLP-1 medications at least 1 to 2 weeks before a procedure. It does depend on what procedure. If you're having like a colonoscopy, it's usually 1 to 2 weeks. If you're having like a major surgery, sometimes it's up to a month. But that is you would have to talk to your actual surgeon and your doctor because it's based on what they want. And that's just because since we do have that decreased GI motility, they want to avoid you having any sort of aspiration events where you didn't have that stomach empty out all the way before surgery.
Okay. Yeah, that's good. There was a couple questions that came in through the Q&A. Erin, I always say Meg 7. I don't know if it's Meg 07, but that
Mega
is
7, yeah.
that's great. And then a question about, can a protein shake be okay for your protein if you're having a hard time? Is that a
Absolutely. Oh yeah. Yeah, absolutely.
doing a good
Um,
recommend?
I mean, I like to tell people however you can get it in, and you kind of have to plan for it, because it is a lot of protein that we're recommending. And I know it's not possible all the time, especially like, if you have busy work schedules and things like that. So yes, definitely.
Perfect. Okay. Erin, I see you have some questions about reaction sites with BioBoost. Do you want to get into that, Ellie, or would you prefer that go in the?
Um, I if you would reach out to me in the portal about that one,
Yeah.
like I said, site reactions are kind of tricky because there's a few questions we want to ask about it.
Mhm.
And so that's something that I'm always going to recommend you let us know about so we can make sure, is it normal, is it not?
Okay. Perfect. All right. So, yeah, let's get more into the constipation and diarrhea topic.
Yeah,
um,
this one's a little bit of a longer one,
yeah.
mainly because I'm a little bit more passionate about the constipation.
Hmm.
I think when it comes down to all these side effects we're discussing, a lot of people think they're normal. Like,
Hmm.
oh, I'm on the medication, so yeah, I mean, I'm constipated.
Hmm.
Prevention is super important to me. I don't want you to be constipated. I want you to be as normal at your baseline as possible.
Hmm.
At the end of the day, we are slowing down the gut. So if we let that go and we don't listen to it, then, you're going to end up with complications, blockages,
Hmm.
upper stomach issues, things like that. So we really do want to focus on prevention.
Hmm.
I will even go further into that and say, like, on our intake forms, the reason that I ask about diverticulosis, even though you're not going to hear about anyone talking about that being an issue, is because I've had patients who, just in my own practice, have had a history of diverticulosis, got mildly constipated, ended up with an issue, like, had to go to the hospital
Yeah.
because of it. So
Okay.
I like to know if you have that problem. That way, if you're like, hey, I'm constipated, we can pay like extra attention to that and be like, hey, we really need to get this under control. So if that's you, like, just know that like you should take the constipation pretty seriously. I've developed like a plan of like steps of, here's where you can start. If that doesn't work, here's this. If that doesn't work, here's this. That
Mhm.
way, like you kind of know what to do next. But if
Yeah.
you're ever unsure, let us know what you're taking and how you've been managing it so we can help kind of tweak things because everybody, reacts differently. So, first step, um, like we talked about, prevention's key.
Mhm.
Um, water intake is going to be super important. So, set your limit for, your day and make sure you're achieving that. And that way you can make sure you're staying super hydrated for so many reasons, but for constipation too.
Okay.
The first thing with lifestyle and dietary modifications would be fiber intake. 20 to 35 grams a day is recommended. But I will say this, don't just go slam 35 grams of fiber when you don't really pay attention to that. I would start small and then like kind of work your way up because it can actually make your bloating worse. So if you're
Oh,
somebody who's having a
interesting.
lot of bloating and things like that, I'm also going to ask you like, hey, how much fiber are you having? Is this new for you? Because your body kind of has to adjust to the fiber. So
Okay.
just know that like you kind of need to start small. So um
Makes sense.
the I do have like a little diagram that I can either send to you, Dara, for you to
Yeah.
show people, but there's like a little diagram of like certain foods and how much fiber content it has that I got from the up to date app that I use for education.
Okay.
So I will make sure that we have that available to you guys.
Yeah.
There is certain side effects with fiber, like I said, other than bloating. It can cause flatulence, cramping, things like that. So make sure you're drinking a lot of water with it
Yeah.
and increase slowly. If the water and the fiber intake doesn't help, then the second step would be what we call bulk laxatives.
Okay.
That's not just like go take a laxative. There's different types. So with bulk laxatives, it's actually like a fiber containing thing where you basically also want to start small. So examples, Metamucil, like psyllium. When people are taking that and they have bloating, it is
Mhm.
fiber containing. So that's why you want to kind of start slow. FiberCon, Benefiber, these are all fiber products that you can take. If you can't get that fiber in and not enough,
Okay.
those can be added into your daily regimen to help you basically meet that fiber content. But if you're having a lot of upset stomach, cramping, you might need to back that down and try the next step. So, or if you're still not having a good response in daily bowel movement, you would add in this third step, which would be a stool softener or another type of laxative like Miralax.
Okay.
Um, the thing with Miralax, I mean, what's nice about it is it's a set dose. You don't have to keep increasing. So I always start with Miralax because it's a powder. You can throw it in a drink and
Mhm.
it's 17 grams a day. And that's the dose. You don't have to like add more. And that's nice. If we're going to add in other stool softeners, if the Miralax doesn't work and we're already doing good fiber and water, my first go-to would probably be Colace because you can kind of titrate it up and down on
Okay.
if it works for you. Like you can start with 100 grams, which is like one little capsule. And if it's not working, let us know. We can always add in, one in the morning, one at night, and just, kind of make it to where it's working well for you. There's other kinds that we can try too, but that's just an example. Um, the last step, like if none of that is working, you're still having issues, the main thing I would ask you is like, are we just dealing with like, some chronic constipation issues? You might have had constipation before
Mhm.
starting this medication and it's just something you deal with. Then having that immediate relief laxative might be something that you need to kind of like start over and get yourself cleaned out so that we can kind of start back on a regimen.
Okay.
But I wouldn't just take a stimulant laxative as
Okay.
like your go-to. I want you to try those other steps first and try to get on a good daily regimen and only use this for like immediate relief. Things would be like, Dulcolax, Dulcolax, things like that actually have a stimulant in them
Okay.
because it's gonna work, but you don't want to use that every day. You don't want to get dehydrated. That's the main thing. Like at the end of the
Right.
day, all these side effects we're discussing, my prevention number one is dehydration. You want to prevent that because it's going to hurt your kidneys.
Okay.
GLP-1 medications are cleared through the kidneys. So if you or vomiting, having excessive diarrhea, things like that, or you're taking stimulant laxatives all the time, you're going to get dehydrated and end up with a kidney injury. So just know that. Um, if the stimulant laxatives don't work, my last ditch effort is to do like a saline enema,
Okay.
because it can sometimes go in from the other way, can help get things cleared.
Mhm.
I will say this, if none of these things work, or you're having abdominal pain with the constipation, go be seen, because I don't want you to ever have a blockage and us, wait on it and end up with a severe complication, perforated bowel, things like that.
Mhm.
So I try to help you kind of work through things you can do to help prevent. But, like I said, if you're having abdominal pain with these things happening and you've tried what I've recommended,
Mhm.
don't hesitate to go be seen, make sure nothing's wrong. So, um,
That's good.
what else can I add in?
No, I appreciate that because I think people get confused between all the different options there are for constipation.
Yeah,
What is Meg 7? Is that a stimulant or is that what is
that's a
that
supplement you can
like?
take. That's actually not like, I don't even, somebody actually might have a better, I know a ton of people of our patients take it, but I don't think you can buy it. I think you can't get it over the counter like at CVS. I don't think. I'm looking really quick. I think you have to buy it online.
You can
You
get it
can
on
get it on Amazon. I mean, I know it's a
yeah,
colon cleanse. So,
Amazon
I mean,
and
the thing is
what's
that I know it's natural too, and that's why people like it.
yeah,
But you can take
okay.
a lot of these things together. So a lot of my patients will take the Mago 7 and one colace, and that
Mhm.
really does it for them. Some people only need the Mago 7. I don't want to tell you anything wrong with it, or like the wrong information on it. Like I said, I don't have the exact like
Yeah. No, that's okay.
ingredients in it, but I know that people swear by it. So
Yeah,
it is something
it's
like for sure to look into. Amazon, someone saying Amazon, yeah, look at the ingredients on Amazon too. But
okay,
I'm pretty sure that it's just like a cleanse that you can
like
do.
a cleanse. Okay, yeah, and I got mine at GNC. So Amazon
Yeah,
and
that's
GNC
fine.
have them.
Yeah.
Yeah. So I don't
Mhm.
know if it's like at CVS or Walgreens and stuff,
I
but
don't think so. Yeah, I'm pretty sure you can only get it online.
okay. Yeah, that makes sense because I know that that can sometimes be overwhelming. It's like, okay, which do I
Hmm.
go for? Stool softener,
Yep. Yep.
stimulant. Okay.
Yep.
Yeah, I think that's kind of it for questions on that. That really is super helpful.
And I
Um,
can provide some information on Mago 7. Like I said, I like to like make sure I know
yeah,
what I'm saying before I tell you for sure. So I'll look more into it, because I mean at this point I really should know exactly like what category this falls under. I
right.
don't like put it on my recommendations just because it's
Mhm.
not, like I said, not something you can go grab. It's just something that I do hear people swear by.
Yeah.
Um, but I'll look more into that, and that way we can make sure we're giving you guys, the right advice.
And then yes, so someone asked if we could put that on the app. Yes. So anything that we talk about, last week we discussed dosing, things like that. So we put it in under the links so you can find it there. And it's also under another section in the app, like I can't remember off the top of my head, education and product information or something like that. But yes, and that Allie will get that. We also do have a managing side effects in there already under that product knowledge. I just can't remember what the space is specifically.
Yeah. I mean,
Um,
I will say like the ones that we have like on there might not be as in depth too.
yeah,
So
no,
if
yeah,
you want like more information, you can always message me on the portal. And I can give you like the more in-depth descriptive one that I have. Yeah.
okay,
The last thing about diarrhea, I know that we kind of touched on constipation, but diarrhea,
yes, yes.
you might see it when you first start the medication, sometimes when you have dose increases, sometimes certain foods, like we talked about, fried, fatty, greasy, sometimes sugary, alcohol. There sometimes is a trigger. So for some people, it might be pizza. Some people, it's chili. Some people just have a certain trigger that they have found triggers diarrhea episodes.
Mm,
The only time it's a real problem is if it's not going away. So if you're having diarrhea every day for a week, please don't take your next injection. Like let's kind of touch base and like see where you're at, because like I said, my alarm bells for that would be dehydration. I don't want you having dehydration and having a kidney injury from that. Number one, losing all those electrolytes. You can't just drink a ton of water and be losing electrolytes. You're going to cause other issues. So
mhm.
it's not normal to be having diarrhea every day. Um, so we either need to talk about, oh, is your dose too high? Or is there something else like underlying going on? What's your history? Do you have, a history of colitis? Things like that. So please always, always let us know. If you are having the diarrhea that happens a day or two after the shot, I still wouldn't increase your dose until it's gone. Similar to the nausea. When you're having side effects, you don't want to go up until those things have resolved. So let your body settle, and then we can go from there. You can take, certain medications, but always make sure they're short and term. And we can reach out to us in the portal, and we can kind of guide you on that. We want to make sure that we're asking the right questions. And making it patient specific when it comes to
Yeah.
taking like over the counter meds for diarrhea, and
Okay.
making sure that it's not like, oh yeah, just take this for forever. It's actually like a 72-hour thing that we do. So, um, yeah, does anybody have any questions about that?
Doesn't look like it. I do when it comes to electrolytes. Do you want to touch on the types to look for? I know some of them can be great, but really high in sugar, things like that. So,
Yeah, yeah. So, actually, one of the best ones I've found is LMNT. It's
okay.
very salty. So you have to really dilute it. But if you are like getting over a diarrhea issue, or you had the flu and you've been vomiting, and you're taking that week off, because like, always hold the medication. If you're sick and have the flu and you're throwing up, hold it until you're better for like an extra week. But like, say we talked and we're holding your dose, maybe it was too high and we're letting your body reset. If you're hydrating that week and you've been vomiting, LMNT, adding that in, getting those electrolytes with the water is great. Diarrhea episodes, that's going to be great. You can always do Gatorade, Powerade. There's nothing wrong with it. They have sugar-free options for that too. But you just want to make sure you're just not like overloading yourself on water alone, and making sure you're having, you can even do um, what is it called? It's like the LMNT packets, but I'm blanking out on it. Um,
Liquid IV.
I'll look here. Liquid IV. Yeah, you can do liquid IV too.
Okay. Perfect. Yeah, I think that is it on that. So another big one that I see on the app, Facebook, is hair loss.
Yeah.
What can you tell us about that?
Yeah, we're actually going to probably do a deep dive on that one too as a
Yeah.
topic soon, because it is a very common thing. And what I always like to tell people is, first things first, make sure you're not losing too quickly. Um, at the end of the day, a pound to a pound and a half a week is ideal. If
Yeah.
you're losing really quickly in the beginning, trying to race to the top in your dosing, things like that, and um, I will say this, it's going to come later. It usually will hit like month 3, month 4, because it's kind of a delayed response. So try to make sure you're not losing too fast.
Okay.
Protein intake is key, especially for this topic. Um, you want to make sure you're eating enough at the end of the day, but especially protein. So if you're having a lot of hair loss, increase your protein intake, and then add in a hair vitamin.
Okay.
So there's lots of hair vitamins on the market, and that's why I was saying we can do an actual topic on this, on like ones that I recommend.
Yeah, that'd
But
be
what
great.
I will briefly touch on with that is, you're going to see more of the expensive like hair loss ones, and there's nothing wrong with trying those. Um, you can also just try the like Amazon versions, things like that, but just make sure it has biotin in it. All the key hair vitamins that we want to see. Just doing the collagen isn't going to be enough. Personally, like, there's nothing wrong with taking collagen products, but you just want to make sure you're getting a good, well-rounded hair vitamin. Even taking like a multivitamin and then taking a hair vitamin together. That's why I was saying like nutrients are going to be super important just in general. So making sure, I mean, I always recommend for everybody to take a multivitamin,
Okay.
but that's the first place I start. And then if it's something that you're still dealing with, then that's when I would go into the fact that maybe we need to do additional lab testing to see kind of where you're at, hormonally where you're at, things like that too, because there could be other things that are affecting it.
Okay. With that, would you say that hair loss is more a side effect of like rapid weight loss, nutrition, things like that, as opposed to the medication itself?
Yes.
Okay,
Yeah.
that makes sense.
Um, for sure. It's kind of a secondary side effect to other things that are from the medicine, but at the end of the day, um, yes, it's mostly from lack of protein intake and losing too quickly.
Okay.
But like I said, it can be multifactorial too. Like there could be other things contributing and making it worse, such as hormone imbalances, things like that.
Okay. Deborah has a great question kind of on the same lines. Can we address being tired and having little energy?
Yeah, for sure. Same thing, actually. Yes, it's a side effect of the medication. Most of the time it's from not eating enough or
Mhm.
lack of protein. So I always tell people like how 9 times out of 10 when I ask patients how much protein are you eating when they tell me they're really tired, they're like, probably not enough. They're like, I
Mhm.
mean, I'm getting my 2 meals in a day, but yeah, I could probably do better in
Mhm.
that point. So I would say start there. You can also try doing BioBoost or NAD.
Just gonna say, yeah.
Um, it can be B vitamins that can be making you tired. So if you have a known B vitamin deficiency or anemia, make sure you're getting good B vitamins will help, which is in BioBoost too. So that will help you. But where you want to start is making sure you're eating enough and that you're getting enough protein. And then NAD too, like I said, it's great because our bodies use it for everything. It's essentially for energy production. So like as we age, it declines. So I think that it's a great tool, and you can take BioBoost with NAD. You can take it together. It's fine.
Okay. Um, I kind of want to go to follow up with, when they become severe, we'll touch on that. But I wanted to address some of the questions that came in from patients as well. Um, Hussein had asked under our event. This has to do with, I'll just read what he posted. I have a question about measuring progress during weight loss. I'm experiencing significant non scale victories like improved clothing fit and increased muscle tone, increased energy levels, but the scale is moving slowly, typically a pound to 1.5 pounds a week. Is it accurate to rely on these non scale victories? We love a non scale victory as a reliable measure of progress. What are some other ways to track progress besides the scale? Love that question. Also, I typically do not feel like I have suppressed appetite. But when I do eat a meal, let's say lunch or dinner in small portions, I feel full for a long period of time compared to how I was previously before the meds. Is this normal? Any insights or suggestions would be helpful. And thank you to all for this amazing platform. You are so welcome. We love it.
Yeah, no, thanks for asking the question. The reason I think that this one is great to ask is because this is actually exactly what you should have happen. So this kind of goes down to go back to that dosing adjustment guide that I've created. Dara confirmed it's in the app for you guys to see. It splits it up into 3 categories. I've created it so that you can look at, here's how I know my dose is working well. Here's how I know it's probably time to increase my dose. And here's how I know I should never increase my dose. So look at that, because you kind of touched on every single part that I cover when it comes to how I know my dose is working well.
Mhm.
You're having good appetite suppression, you're having good portion control, craving control. That's what I want to see. I don't want to see it completely taking out away your appetite. The
Mhm.
next point that I see you make is a pound to a pound and a half a week. That is exactly where you should be. That is even in my guide. That is what I want your goal to be, is a pound to a pound and a half a week on average. Of course, you're
Mhm.
going to have weeks where you don't hit that, or that you might lose 2 pounds, but just on average, being in that range, that means your medication's working consistently and you do not need to increase your dose. What I recommend is when this is happening and it's working well, continue that dose until it's no longer effective.
Mhm.
And then that dosing guide covers what that means as well. So like signs it would be time to increase.
Okay.
Um,
Good.
you want, like I said, it's not a race to the top. You actually want to stay on
Mhm.
the lowest dose possible that you can, that's effective for you for as long as possible.
Yep.
And then when it's no longer effective, you increase.
Mhm.
Because then once you get to the top, there's nowhere to go. So, and then you have other side effects happen. So
Yep.
that's one thing to consider. Um, the next thing I want to jump into, instead of addressing the next thing we were going to cover, Dara, is actually covering what the more serious side effects look like, because this will answer this question. So
Yep.
when it comes to talking about the more serious side effects that I'm looking for, a lot of it comes down to seeing that abdominal pain, vomiting, fever,
Mhm.
food intolerances, like you're throwing up right after you eat, things like that. Those are warning signs. The
Mhm.
main ones being pancreatitis and gallbladder issues. If you've ever had pancreatitis and gallbladder issues, you should not be taking this medication. So if that's something that you've been having happen, please let me know immediately. But that's something that we disqualify you for. If you've had your gallbladder out, of course, that's not really something that you need to worry about, because after you get your gallbladder taken out, you can take these medications. But if you've had gallbladder attacks and you haven't had your gallbladder out, you shouldn't take it. Now, um, it's more commonly seen on high doses and long-term high dose use, but the signs of both of those things would be abdominal pain, vomiting, fever. That's why I'm saying if you are having those things happen and we've already talked and it's not that the dose is too high, then you need to go be seen so that we can make sure we're getting ahead of it before you end up in the hospital. So please
Mhm.
take those signs seriously. Um, uh, Kidney injury, we've kind of touched on that too already, but that's like
Mhm.
kind of the next one in line for me when it comes to seriousness. If you have any signs of dehydration, even if it's from the flu, please hold the medication and talk to us. Um, dark urine, decreased urine output, dizziness, those are all signs of dehydration. But you probably need some IV hydration if that's the case. So um, low blood sugar, very rare, but it can happen. It's more common in diabetics. But if you have blurred vision, nausea, dizziness, shakiness, sweating, those are signs of low blood sugar. So it might be that your dose is too high. Let us know so we can talk about it. Um, I do have some people ask about gastroparesis sometimes. It's extremely rare, but
Mhm.
that's something we would need to hop on the phone about if you're having immediate vomiting episodes after eating, or vomiting up contents that are from like 3 days ago. That's
Mhm.
something we need to talk about. Like I said, extremely rare, but more common in people who've had a history of gastroparesis. So if you've had like an abdominal surgery and had a post-op complication of that, you're more likely to get it again. But yeah, just
Yeah.
something to keep in the back of your mind. Depression is something we hear people ask about sometimes. Again, more so seen in people that are already dealing with an issue with that. It can worsen depression or suicidal issues. So if you're someone that is on the medication and it's not well managed, I really recommend talking to your primary care or whoever helps you with that to make sure that it's being managed well. Um, and I always like to make sure, if you're having depression or suicidal thoughts, please go talk to somebody and be seen. We don't manage those things.
Mhm.
And I want you to make sure that you're not ignoring it. Um, it is, it is again, a rare side effect, but it's something not ever to ignore.
Yep.
And then I do have people ask about blood pressure sometimes. So I will just briefly touch on
Yeah.
that. It's not a side effect of the medication to have low
Mhm.
blood pressure. It's actually a side effect of losing weight. So over time, if you're someone who is on blood pressure medications, keep an eye on your blood pressure, because as you lose, you're going to have lower blood pressure and you're actually going to come down in your medications. So just something just to keep in the back of your head. You're going to get healthier, losing weight. It's going to lower your blood pressure, which is great. It's what we want to hear. But what we don't want to happen is you have a low blood pressure. You're still taking the same dose as you were before you lost all this weight and your blood pressure bottoms out. So just
Mhm.
know that it's going to eventually come down as you lose.
Yeah. That's good. Yeah, so we kind of touched on if you want to kind of back up on the managing side effects if they're severe, definitely reach out to us, but don't wait for us. We do have normal business hours. Sometimes it takes us a little bit longer. Our med team is usually not online on the weekends, nights, things like that. So don't wait if those things are get severe for you on what to do. Just go to the ER, and then like Ali said, we'll follow up. Provider, either her or another provider, will follow up with you, just make sure things are good. But yeah, don't wait on us to tell you to go in. Brenda, I think that is going to be something to definitely address in the portal. It's a little bit more specific to you. Um, and then same with the Bio Boost. If you're experiencing that, don't take it anymore. Reach out to us today so that we can kind of go over that with you.
Oh,
Let's,
fasting. I kind of will touch on that a little bit.
yeah, that would be
Um,
great. Yeah.
what I would, so I think fasting is great. It is a great tool for overall health, cellular health. Um, it's great. I just would be extra careful. When you're talking about blood sugar drops, obviously period of time. I know like with Ramadan, there's like like it's longer periods of time than just, um, the typical maybe skipping breakfast. So what I would say is, you can always like the tools that you can get, um, for continuous glucose monitoring might be beneficial if you know that this is coming up and you have the ability to get those purchased online. You can order them now through Abbott, I believe. If you have more questions about that, let me know. But it might be a good idea just to have a good eye on what's happening.
Mhm.
And if you want to talk more specifically about that in the portal, or over a call, let me know, especially when it comes to like religious fasting and things like that. I would want to be extra careful in your medication. We might need to either hold a dose or go down in your dose while you're doing that for that period of time. So, yeah, but if you're just adding in normal fasting, just like I don't, I fast until
Mhm.
12 o'clock, you shouldn't really have an issue. What I would just, increase your protein intake for the times that you are eating, things like that, because that protein is going to help make things last. Eat a good protein snack before bed, to help those blood sugar dips and drops. But typical fasting should be fine. Just always something to keep in the back of your mind. Signs of low blood sugar, like we talked about,
Yes.
shakiness, sweatiness, dizziness, nausea, things like that.
Okay. Great. Erica, I would reach out to the portal on that. To
Having
have
an issue with BioBoost, I did see a few comments about
you.
asking if we'll ever offer individual products. Um, I don't have an answer for you right now on that specifically, but if you're somebody who's having an issue with, a particular ingredient in BioBoost, but you're interested in getting a different ingredient, just reach out to me and let me know. We can talk about it because I might be able to help you, find a good solution. It just depends on what it is.
Yeah, perfect. Okay, I think that kind of covers everything. We've
Yeah.
gone a little bit over and don't want to.
Sorry, guys.
No, no, it was perfect. This is so helpful. These are things that come up most frequently. I just want to say if you are obviously you're not going to see this until it's a replay if you're missing it, but we do post these just in case you are on here now and are wondering, oh my goodness, what if I miss it? It will immediately, as soon as we're off of here, it will show up under events. We also are posting it to our YouTube channel. We're hoping by the next Friday, so like between Wednesday and Friday, we'll get them up there as well, so you have multiple places to look. Facebook has just been so finicky with us lately, so we haven't been posting as much on there just because we're about to lose it if we continue posting. So it's ridiculous. That is why, again, broken record here, trying to push you guys to the app just so you don't miss out on stuff. We post, anything that comes up with hot topics in the industry with GLP-1s and all of that as soon as we have them. So yeah, you just don't want to miss that, but just wanted to let you guys know you don't always have to be live with us. You can catch this replay in the app as well after we're done. And like I said, on YouTube, should be up by like Wednesday or Friday of the following week. But all right, is there anything else? Make sure that you check in with us if things are severe. Don't wait. Go to the ER, go to urgent care, and then
Or even
definitely.
if you're not sure, even if you think it might be mild, but you're not sure, we're always here to help. So we don't want you
Yes,
to ever feel like you can't ask.
right.
The tools we give you are there as a guide, but everybody's different. We don't want you to
Mhm.
ever ignore something. So
Yeah.
yeah, always feel free to let us know.
Yes. And yeah, reach out to the patient portal. I think that is everything that we wanted to touch
Yeah.
on. So,
Yeah. Thank you guys so much. I appreciate it.
all right, we'll see you guys. We are doing these like every 2 weeks, so we won't be on next Friday, but we will the following one is what we're looking at. I did want to say, I had so much interest in my post about doing guest speaking. We definitely want to do that. So please reach out. We're working on a form. as well, because we got so much interest in that. Would love to get people on here that are patients. If you've been on the medication for more than 6 months and have had success, we'd love to hear from you. Would love to have you in our guest spot, have people ask questions. Yeah, so I really appreciate that. Had a lot of men reach out, which would be so awesome, because we do have definitely we have a lot more women on here, but there is definitely a demographic for you guys out there. So I think that would be awesome too. But yeah, we are planning on so many other really cool topics. Would love your feedback as well on how you feel like these are going. If there's topics you'd like to discuss, just let me know. And yeah, we'll just keep on doing these. We love it. So, all right. Well, thank you, Ali, so much.
Yep.
And yeah,
And
we
like
will.
I said, we're going to go more into depth. I know there's a lot of people that want some more support on like, food and dietary things that we can add in. So like, examples. So we're going to try to do a topic on that as well. So just know that that's coming. But if you have specific questions or need recommendations, feel free to let me know. Okay.
All right. Thanks so
All right. Y'all
much.
have a great weekend. Thanks for having me on.
Yep. Bye.
Bye.